A very good morning to all of you. Today we have with us my friend and colleague, Engineer Mission Lokat. He is the chairperson of the Public Grievances Department, Npcc. He has some very important things to share with you all. Also with us is our Dimapur DCC President, Mr. Kutuhal. And on my left, on the far left, is Mr. Andrew, Media Coordinator, Npcc. Uh, let's start with our chairperson of Public Grievances Department. The, the time is yours.
Okay, sir, thank you. Okay, today we really want to focus on 2 points about health and family welfare department in Nagaland. So the number 1 point is lack of basic equipments that are required in here in Nagaland. Okay, lack of basic equipments or material equipments that are required in the medical sectors here in Nagaland. And the number two is lack of medical staff like doctors, nurse, radiologists, technicians, all those. So regarding the first one, lack of basic equipments that are required here in Nagaland. Regarding this issue also, the first thing that I want to mention is last year on 4th of May 2024, 4th of May 2024, we gave a press statement to the Naga Hospital Authority Kohima, telling them to restore the CT scan and mammogram at the earliest. But still then, till today, as of now, they have not restored the CT scan also and mammogram also. Now CT scan, ultrasound, all those are basic equipments that are required in a hospital. And it's not only Kohima being the capital does not have that facility. And it's not that we have not reminded them. We have reminded them many a times. Because it's like playing with the life of the people here in Nagaland. From many other districts, they come to Kohima to get treatment. So in Naga Hospital, since they don't have CT scan, they are referred to some private hospitals. Now somebody who is not able to walk by himself, people used to take him, drag Kurina Garide Rekina. That's how they do the CT scan and all. How much difficulty the people are suffering. So it's not only Kohima. Recently we have through some reports. See, even in Zonoboto there is no CT scan. Those are the things that are happening here in our state. And say example like just to get a CT scan, somebody has to come down from 150 kilometers away from the state capital. They have to travel a long distance. I'm just citing an example. Okay, there are so many other equipments, medical equipments, which I don't know the name also. It is not being provided here in our state. Now I just want to say, how long will this happen? Why? Because see, Nagaland is the state which got statehood before all other Northeast states in Nagaland. I mean, all other states in Northeast. Nagaland is the first statehood pala first. But why? If there is a health issue, we don't get treatment here in our state itself. We have to go to Impal. We have to go to Shillong. See, taking example of Manipur, Meghalaya, and all, they got statehood only after us. There is something wrong with our system, is it? So, through this press statement, I just want to remind the minister concerned also. This health issue should not be taken lightly. Or, see, example like there are at present there are 56 PHCs without even a single doctor. 57 PHCs without even a single doctor. How is that possible? See, one PHC, it takes care of more than 20 villages. At an average, it takes care of 15, 16 villages. So, without a doctor, how is the PHC supposed to run? Bustide thaga manon 13, 14 village, if there is an emergency case, where do they go? That is the condition or the situation, the pathetic condition of our state today. So with this, I just want to tell the government also, stop taking the healthcare very lightly. Why not our state be like our neighboring states? We always see that there are some issues, there are some conflicts happening here in Manipur, but their technology is much, much better than us. They have medical college, they have engineering college, they have good medical facilities. Now, what is wrong with our state? Okay, now that is concerning the first point, the lack of basic equipments that exists here in our Nagaland. Now, the second point is lack of medical staff, lack of doctors, lack of nurses, all those things. Now government may take excuse. Now why is the medical department not functioning properly? They may make excuse that exams are not being made to be conducted. That may be their excuses. Yeah, for many years they have not advertised the post of doctors, nurse, staff, all those. They have not advertised. But it is their own making, okay, I will tell you. There are lack of doctors everywhere. And they will put the blame on the public, or they will put the blame on some associations or unions for not letting that special recruitment drive to happen. But it is all their, like I'm saying, it is all their doing. See, the reason there were many associations or unions who were against the special recruitment drive of 288 vacancies, which includes doctors, nurses, technicians, radiologists, all those. Now, acha, going back to the first point, see, here example like in Zloboto, it seems there is CT scan or all those facilities are there. Mane CT scan is not there, but other facilities are there, but they don't have a radiologist to operate the machine. Those are the things happening. Now, see, they will say, government will make an excuse that they are not able to fill up the vacancies because of some certain associations, but it's never like that. The reason here is, in that special recruitment drive, they have said that they will give 175 extra marks to people who have worked during COVID time. COVID time. Nah, I think that is too much. It is almost like 36% of the total mark. Now you imagine yourself, you get 36% mark even before sitting for exam. How fair is that? Now, for COVID, some other states like Manipur and all, they have given a little mark to those people who work during the COVID. Say example like 10 mark extra. That is somehow acceptable, okay? But directly giving away 175 is not acceptable. And it is against the rule number 9, clause 4 of Npcc also. And it is against the rule number 16, article 16 under Indian Constitution also. It is a violation of that. So they may have excused that because of so many things they are not able to advertise those posts in Alak with you. Hulibi 2020 they gave an advertisement of how many posts? They gave advertisement of 186 posts. And clearly it is written that it is purely a contract for 12 months and no person has the right to ask for regularization. It's mentioned in the order itself. Now, don't think that I'm against those people who are already working, who work during the COVID. I appreciate their work. Hulibi, say example, just taking example, my friend, let's imagine he is a doctor, I myself also. I work under government of Nagaland. He work under private during the COVID. Now, when we are going to sit for exam, I'm already given 175 mark extra in advance. Where will he go? Now, we are humans though. See, those are the things. But still then, if the government was serious enough, it is already more than 1 year. They gave the order for special recruitment drive, but since many of the pressure group were against it, they were not able to conduct that special recruitment drive. Now it's already more than 1 year. What are they doing? they will have assembly. What resolution do they pass, or what benefit do they give by sitting in the assembly and discussing? These things are very serious, so they should actually be taking up these issues. So for us also, what we are saying is, at least the cabinets could sit, have a meeting, and come out with some resolution, make way for vacancies, make way for all those vacancies to be filled up. Like I'm saying, see, 175 is not acceptable, and I don't think that will happen. So at least they have to make some arrangement, isn't it, if they're serious enough. And they cannot simply say that because of the associations banning this special recruitment, they are lacking in manpower. So like I'm saying, serious enough asikuли to pila watahan discuss kurina ekta adjustment huli kurina special recruitment drive to huli paro thakisula. Huli they are not serious to health sector to khatam hui jawle je Nagaland. Example like minor heart surgery to pi na pare Nagaland na pare do. You have to go to some other states. Minor heart surgery to pi na pare. Why is the condition like this? The government has to take this issue very seriously. Yeah.
Done.
Yeah, you can please.
Okay. It's so it's such an injustice, and it's such a tragedy that in this age of so much technology advancements in the medical field, here uh, we we don't have even the most basic of equipments. Of course, some private hospitals might have it, but as we know, the majority of our population are farmers. They mostly live in the rural areas, and it's it's a it's a very big I mean difficulty for people, especially those who live in the rural areas. I mean, uh, there are certain diseases or ailments which can be so easily managed if it was given attention treatment at the right time. But because of all this lack of basic equipments in most of the places in Nagaland, and because of these shortages of manpower, these minor ailments or diseases becomes worse. It becomes chronic, and so many people in the state are going through these difficulties. And of course, there are so many departments, there are so many sectors, but certain certain sectors like the health or the medical sector, and certain sectors like, for example, primary education, these things we should not compromise on. The government, it's the duty of the government to ensure that at least these basic infrastructures, basic utilities are given. There shouldn't be any excuse for all this. No excuse is good enough. These are basic things. It should be available. If our neighboring states, forget about other states, or if our neighboring states can have all these facilities, why can't we? This is just a matter of lack of accountability. This is a matter of misgovernance. This is a matter of utter and total neglect. So if you have nothing more to add, I think that will be all for today.